question. Talk about Obamacare. HHS finally releasing information on insurance premiums, claiming costs will be lower than first thought. But, Karl, you just tweeted, don't believe HHS. Happy talk. Obamacare will increase average individual market premiums by 99% for men and 62% for women. Karl, last night I had a gentleman on here who said just the opposite. So how do I know who to believe about what on this?
Well, read the fine detail on the report that came out of HHS. What the HHS did was it compared their current estimates of costs for some of these the cheapest bronze, silver, and gold policy and the second cheapest silver policy to what they'd originally estimated, to the original Congressional Budget Office projections. They're not comparing it to what you're actually paying. They're comparing it to what they thought you might pay. Now, you're right. If you take a look at it and compare what the rates are in their estimates to what people are currently paying, young men on average are going to pay between 97 and 99% more than they currently now pay. They'll pay less than the CBO originally projected, but they'll pay more than they pay now. Young women, 55 to 62% more. North Carolina men get hit the worst. They will pay, if you look at the current rates in the state and compare what Obamacare is going to require them to put out of their pocket, it's a 305% increase. And Nebraska women are going to get hurt the most among women. They're going to be a 237% increase over what they currently pay. Where do you get your numbers?
Where do you get your numbers? Well, everyone keeps throwing numbers at me, and okay.
Here's where people ought to go. Manhattan Institute began several months ago getting information from individual state insurance commissioners about the current rates that people are paying for their premiums for health insurance, and they've got this up on the internet, so you can compare what Obamacare is going to cost you in your state compared to what you're currently paying on average. Manhattan Institute. The project was overseen by a brilliant young man named Avik Roy. It's really good. They don't have all the states because not all the states have supplied the information, but you can find in there a pretty interesting explanation of what you're now paying versus what you're estimated to pay by the government. I'll give you two examples. 27-year-old using the cheapest bronze plan. That's the cheapest plan that the government is going to allow you to have versus the lowest cost currently available coverage. In Wisconsin, I know you're interested in this, that will be you will pay 384% more for the cheapest plan that the government's going to allow you to have versus what's currently available. In Louisiana, it's going to be 379% increase over what's now currently available. So, yeah, the government is basically lying with numbers. They said, oh, we estimated it would be this much, but it's really only going to cost this much, but we're going to leave out the fact that you're paying this much. And I think it is really scandalous that Secretary Sebelius, in a shameless attempt to promote Obamacare, is putting her imprimatur on this really misleading, deceptive. Look, if the government could be sued by the Federal Trade Commission for deceptive advertising, Secretary Sebelius would be slapped with lawsuits today about a mile thick.